Good afternoon. Today is another great day for Alberta. We're not only entering step one of Alberta's Open for Summer plan, but we're also taking a big step forward in our vaccine rollout. This is the start of opening Alberta for summer and getting our lives back to normal. This is where we start to live the promise that these vaccines have brought. 2 weeks ago, on May 18th, we reached the threshold of getting 50% of eligible Albertans vaccinated with at least one dose, and with fewer than 800 people in hospital with COVID-19. It's because of your collective efforts that we can safely begin easing public health measures today. The progress that we've made is remarkable. The time is clearly right to take this next step. Before I get into that, I'll provide today's daily numbers to show you just how far that we've come. Over the last 24 hours, we've identified 209 new cases of COVID-19 and completed about 4,100 tests. That means our positivity rate is 5.1%. And we have now 438 people in hospital being treated for COVID-19, 127 of whom are in the ICU. But let's look back just 1 week. Over the past 7 days, we've seen amazing progress. Our active cases declined by 44% between May 24th and May 31st. That's 5,300 fewer people who are sick with COVID today than a week ago. Our hospitalizations dropped by 133 patients over the same period. And same for the positivity rate. It went from just under 10% to just over 5% today. The R value, the rate by which we estimate the virus transmits, remains steady at 0.72%, which tells us that the steep decrease in cases continues. Now, let's turn the clock back and compare today's numbers to the peak of the third wave. At that peak, just over a month ago, we had over 25,000 active cases. That means active cases have declined by 73%. Actually, it was under a month ago. That was 3 weeks ago. So we've seen a 73% decline. The average number of new cases each week has fallen from nearly 2,000 to under 400, a drop of almost 80%. Think about the next time people say that vaccines don't work or that we're moving too fast. The people who are sickest and the pressures on our healthcare system continue to decline. Today, there are 438 people in hospital with COVID, a decrease of 40% from the peak on the 11th of May. The same is seen in intensive care, from a record 178 admissions on May 18th, down to 127 today. As these numbers continue to trend downward, we're beginning to see an easing of the pressure on our healthcare system. Now, don't get me wrong, we continue to have frontline staff, intensive care nurses and doctors and respiratory therapists and others who are doing tremendous frontline work and still, in many cases, under real pressure, and we deeply appreciate their work, but we're grateful to see the numbers moving in the right direction. The reason for this decline, which has been seen in many places around the world, is, in large part, vaccines, of course, in addition to the difficult measures that we brought in a month ago. Today, more than 2.81 million doses have been administered in our province. More than 63% of eligible Albertans are now protected with at least one dose. What's more, there have been only 433 so-called adverse events reported to date out of over 2.8 million vaccine doses administered. In other words, 99.98% of these vaccines have provided protection with no reported significant health concerns. And please remember that the next time somebody tells you that these vaccines are unproven or unsafe. An army of healthcare workers, health officials, pharmacy staff, and pharmacists are keeping our vaccination clinics humming smoothly, and I want to thank them for their dedicated work and effort. Throughout Alberta's rollout, they've quickly shifted gears to meet challenges of changing supply and demand, and they're working quickly and efficiently to get every Albertan protected. The Open for Summer plan is based on the expertise of health officials and the real-world evidence of the protective power of vaccines. Some have said that the plan is not properly considering variants or taking steps to improve screening for variants of concern, but that couldn't be further from the truth. Alberta's variant screening system has been one of the best in the country. Starting this week, we are once again screening all positive cases for variants. What's more, this includes screening every single case for the B1617 so-called Indian variant. But make no mistake, we can't stop new COVID variants from emerging. But we also cannot live in fear for the rest of the year, the rest of our lives. We know that vaccines work, even against these variants. We know they prevent severe outcomes like hospitalizations and death. And we know Albertans have worked incredibly hard to crush the spike and get vaccinated so we can have a great Alberta summer. Some have said that our plan does not consider second doses, which is also incorrect. Second doses are vital, which is why Alberta has led the country in administering them. Prior to the third wave in late March, only 2.8% of the eligible population was immunized with a second dose. As of today, more than 1 in 10 have received both first and second doses. And amongst those over the age of 75, coverage has increased from 7.5% at the end of March to 74% today. So amongst the most elderly, who are generally the most vulnerable to this disease, 3/4 have been fully vaccinated, a critical factor. And Alberta on that is a leader in Canada. At 10.4% of the eligible population fully vaccinated, Alberta leads all provinces and is almost double the national second dose average. Today, with supply increasing, we're taking this even further. And so today I'm announcing that every Albertan who has received their first dose of vaccine will be able to book their second dose appointment by the end of June. I know that millions of you have been waiting to hear this good news. From day one and throughout the pandemic, Alberta has had, I believe, one of the best vaccine rollouts in the country. The only thing that has held us back has been inconsistent supply. As you remember, earlier this spring, due to limited supply, we and other provinces had to change the interval between first and second doses to provide as many people as possible with the protection of at least one dose. Well, now that over 63% of people 12 and older have at least one dose, and there's a steady supply of vaccine coming to the province, we can begin administering second doses. This is yet another big milestone in our fight against COVID-19, and it takes us even closer to a post-pandemic world where we can get back to doing what we love and spending time with those that we most care about. Now, before you pick up the phone or log on to try and schedule an appointment, I'm sure some people have already done that. Bookings, please, this is an important note, bookings for second doses will be sequenced in the order that first doses were administered to ensure that everyone receives them at significantly less than the maximum 16-week interval. So Minister of Health Shandro will provide more details in a second, as well as what this means for people like myself who received the AstraZeneca vaccine. But if there are no unexpected delays to shipments, we expect most everyone awaiting their second dose should have it by the end of summer. Now, if you haven't yet booked your first dose, don't worry. You haven't lost your spot in the line. We'll continue to prioritize first doses for anybody who wants to be vaccinated. Though I encourage you to book your appointment now so you can confirm the time slot before things get too busy with these second dose bookings. We need Albertans to sign up, to show up, and to follow up for both their first and second doses. Here's how second dose booking will roll out. If you are one of the 239,000 Albertans who received your first dose anytime in the month of March or earlier, but you've not yet received a second dose, you can book that second dose appointment today. So just to make it real simple, if you got your first dose in March or earlier, you haven't yet had your second dose, you can go sign up right now. If you received your first dose in April, like myself, you can book your second dose starting in 2 weeks from now on June the 14th. So just to repeat again, if you got your first COVID-19 dose in the month of April, you can go online or register by phone or with your community pharmacy 2 weeks from now, June 14th. So please give the folks who are a little bit older than us the first kick at the can to get signed up. And if you got your first dose in May, these are the youngest Albertans, you'll be able to book your second dose starting in 4 weeks on June 28th. So March and earlier, today, they can go and get booked. April, people got dosed first time in April. You can go on June 14, and the younger folks get to go and book their second dose appointments on June 28th. That means all Albertans with their first dose will be second dose eligible by the end of June. And this is fantastic. It's also a big part of why the Open for Summer plan, we are confident, will work. While being fully vaccinated wasn't defined as a public health trigger, it is a critical part to crushing COVID-19 in Alberta once and for all. It's embedded in our plan for population protection, as of course is natural immunity. On Friday, we reached the threshold of 60% of all Albertans over the age of 12 receiving at least one dose, starting the clock on our 2-week waiting period before those doses are fully effective. And that means that Alberta will enter stage 2 of the reopening on June the 10th. We've confirmed that. As long as hospitalizations stay below 500 and keep trending downwards as they are very clearly. The return to dining in restaurants with friends, gyms back open, larger outdoor gathering limits, and much more. We're close to all of that if we just need to keep following the rules and get those vaccines done. And after we reach stage 2, it will only be a matter of time before we reach the final stage of our Open for Summer plan. So the summer we have and the fall that we will prepare ourselves for is completely within our control. Every person, every single Albertan can make a difference, at least those who are 12 and above. Every dose delivered is another step closer to protecting your loved ones, your neighbors, and your community, and another step closer to getting our lives back to normal. If you haven't made an appointment, please do so. Please get protected. Life has been so closed off from others for so many of us for the past 15 months. It's time to open up Alberta, but the power is in your hands. And in the next few weeks, please continue carefully to follow the public health measures so we keep pushing those numbers down. I'm confident that Albertans will clear these last hurdles and push towards a wide open summer with determination and a collective effort to keep not only themselves, but everyone, especially the vulnerable, safe. Thank you for that, and now I will invite Minister Shandro to offer his remarks.
Thank you, Premier. And today is the day that so many Albertans have been waiting for as we mark a turning point in our vaccine rollout. I'm delighted to be here to provide details on how and when Albertans can get their second doses. As Premier mentioned, Albertans can receive their second doses in the same order in which they received their first ones. Those who received their first dose in March or earlier can book their second doses province-wide, starting immediately. And individuals who were vaccinated in April, like Dr. Hinshaw, myself, and Premier, will be able to start booking on June 14th or after. And those who received their first dose in May can start booking their second at the end of the month, starting on June 28th. And we've spaced out these start dates on purpose to ensure that everyone is still getting their doses within the maximum 16-week interval. In fact, the longest interval will be just over 12 weeks, as it was just 12 weeks ago when we extended our interval. And we honored all of the second doses that had been booked prior to that. While we begin these second doses, first doses for all Albertans still remain the priority over the next few weeks. If you have not already received your first dose, please make an appointment to do so as soon as possible. Going forward, we expect to be able to shorten the window between first and second doses even further for those who are still booking their first shot. And as long as the supply allows, the interval for Pfizer and Moderna, these are the two messenger RNA vaccines, will be lowered over time to a minimum of 3 to 4 weeks. For those who had a first dose in April and May, it's important to remember that these booking windows for second doses are well ahead of the schedule that we had anticipated. Translation, you're getting a second dose way sooner than we had expected. And that's why we're asking anyone who got their dose in April or May to hold on just a little bit longer and not call or to go online to try to get your second dose until it's your turn. Attempting to book before your eligibility date means that someone else risks not getting their shot within the appropriate time. And it causes delays for AHS, it causes delays for our pharmacy partners and their staff who have to cancel appointments for those who are not yet eligible. If the rollout of these second doses goes even faster than expected and we're able to move up timelines, we will. Government is just as keen to get these doses into the arms of Albertans as you are. Alberta's Open for Summer plan is based on first doses, but second doses are critical to make sure that we stay open. And there will be enough doses for everyone, and if our supply continues to arrive as expected, everyone will be able to book theirs within the next few weeks. AHS will be using their auto callback system to inform people they vaccinated for their first dose that they're now eligible for a second dose. Wherever possible, pharmacists and physicians will also call or text or email their patients to let them know about eligibility as well. However, you can book an appointment at any time, starting on the day that you become eligible. You don't need to wait to hear from AHS or your physician or your pharmacist. It's you're able to make those appointments when you are eligible without waiting to hear from somebody. To those who have received the AstraZeneca vaccine for their first dose, like Premier, like me, like Dr. Hinshaw, I know that there have been a lot of questions about the plan for second doses. And I know that this has created anxiety for some, and I want to thank you for your patience. Safety and efficacy have been at the forefront of our decision-making, and we wanted to make sure that we got it right. Starting today, we're shortening the timeline for AstraZeneca second doses to a minimum of 8 weeks. And this is in line with the emerging evidence and the approach that's been taken in Quebec. What this means is that Albertans who received AstraZeneca in March can book their second doses starting today, as they will be between 9 and 12 weeks from their first dose. And just a reminder that AstraZeneca remains a safe and highly effective option. That being said, we recognize that some Albertans who received AstraZeneca have concerns after carefully reviewing the evidence from other jurisdictions. While AstraZeneca is still a good choice, we will offer Albertans a choice. They can get another shot of AstraZeneca as their second dose, or a messenger RNA vaccine instead, like Moderna or Pfizer. And this aligns with the new recommendations that were released today by the National Advisory Committee on Immunizations, NACI. To book a second appointment for AstraZeneca, you'll need to go through AHS or to one of the pharmacies that are listed online as offering AstraZeneca. To book a second appointment for a messenger RNA vaccine, you can contact any participating pharmacy, or you can use AHS and their online booking tool, or through calling 811. Today is another important day in our journey out of this pandemic, and I want to thank all the staff at AHS, all of the staff in our pharmacies, all of our physicians and their staff who continue to work tirelessly to administer these vaccines, and as well all of the Albertans who are choosing to be protected by getting the vaccine. So thank you very much, and Dr. Hinshaw will now provide today's COVID-19 update. Dr. Hinshaw.
Thank you, Minister, and good afternoon, everyone. I would like to begin today by providing some additional details about the expanded variant screening that is now underway to follow up on the Premier's comments. As you know, our labs have done remarkable work in screening for variants of concern. We not only started screening all positive samples in late January, but also conducted retrospective testing of all positive cases in our border pilot. Last month, when demand for testing was very high, our lab made an adjustment to ensure Albertans could continue accessing testing and receiving their results in a timely fashion. To preserve capacity and keep wait times low, we limited the screening to targeted, high-risk samples and a representative sample of all other populations. This approach was in line with other provinces and was very effective in helping track the spread of variants in a representative sample during our third wave. However, with positive cases rapidly declining, we are now able to once again expand our screening approach. Starting today, all positive test results in Alberta will undergo screening tests for variants of concern. This includes screening for not only the B117 or UK variant, which is the dominant strain in Alberta, but also the B1617 variant first identified in India, and the other two variants of concern, P1 and B1351. Because we are screening all cases, we may see the case counts of these specific variants begin to rise even as our overall cases fall. But it is a good thing to expand this screening. Every case we identify will help us track and limit further spread as we move toward further reopening. As I've said before, testing is a partnership that takes all of us. Please get tested if you are experiencing COVID-19 symptoms or if you're identified as a close contact. It remains essential to protecting you and everyone around you. While the Premier already updated you on most of today's numbers, I will now add that there are active alerts or outbreaks in 417 schools, which represent 17% of schools in the province. This includes outbreaks and alerts that were opened before the 2-week online school shift, and these are closing gradually as the 4-week time period after the last case ends. Sadly, one new death was reported to Alberta Health in the last 24 hours. I extend my condolences to the family and friends of this individual and to anyone who has lost someone they loved. One of the best ways we can avoid future deaths from this virus and spare families the pain of watching their loved ones suffer any severe outcomes is to be vaccinated. It's wonderful to see so many Albertans have already received their first dose and the protection that comes with it. There's no question that this uptake has had a substantial effect on reducing the spread of COVID-19 in the province. If you are unsure about getting a first dose, please remember that every person who is protected will help us prevent future waves. These vaccines are safe and they will protect you and those around you. Later this week, I will be sharing some preliminary data looking at the impact of vaccines on our case numbers and hospitalizations in Alberta. However, today I want to stress how important it is that we all get second doses. We know that first doses offer good protection against COVID, but 2 doses offer a significantly higher and longer level of immunity. This is particularly true for protecting against emerging variants like the B1617. I strongly urge everyone to book their second dose as soon as they are eligible. No matter what vaccine you received for your first dose, we will have a second dose available for you. I'm told that some Albertans have been concerned about getting a first dose with Moderna vaccine, worried that there may not be supply to get a second dose of the same product. The good news on this is that while, for the most part, we will give the same vaccine for first and second doses, the National Advisory Committee on Immunization has advised that mRNA vaccines, Pfizer and Moderna, can be used interchangeably for second doses if needed. Both Moderna and Pfizer are safe and highly effective, so you can be confident you are receiving full protection, whichever vaccine you receive. Also, as the Minister mentioned, people like myself who have received AstraZeneca for their first dose can choose either AstraZeneca or an mRNA vaccine for their second dose. This is in line with the National Advisory Committee on Immunization's recommendation, and I want to stress that both AstraZeneca and mRNA vaccines are good options. Both vaccines will further protect you from severe illness. Albertans who choose to receive a second dose of AstraZeneca vaccine should know that the risk of blood clots, known as VIT, after the second dose of AstraZeneca so far appears to be lower than with the first dose. They remain extremely rare. In the UK, among 9 million second doses of AstraZeneca, only 15 VIT cases have been reported so far. That is one case for every 600,000 doses, which is significantly less than reports after first doses. That being said, we are in the very fortunate situation where mRNA and AstraZeneca vaccines are both available, and there will not be a delay in receiving either vaccine, whatever option you choose. Both options are valid, and both will count as a complete series in Canada. There may be some differences in milder side effects after your second dose. Evidence is still emerging, but based on the UK trial of mixing AstraZeneca and then Pfizer vaccine, it appears people who received a Pfizer dose 4 weeks after AstraZeneca had more general reactions such as fever and aches than those who received 2 doses of AstraZeneca vaccine. Most symptoms happened in the 2 days after immunization, and symptoms went away on their own. There were no safety signals noted in this trial. In a study from Spain with AstraZeneca, then Pfizer vaccine after 8 weeks, side effects were mild and also went away on their own. Whatever vaccine type you choose for your second dose, if your first dose was with AstraZeneca, we recommend that you wait at least 8 weeks before getting the second. Having an 8 to 12-week wait between first and second doses of this vaccine gives a better overall protection than having a second dose sooner than that. If you're not sure what option is best for you, please consider talking to a healthcare professional. We've also put information on our website about the information on either getting a second dose of AstraZeneca or second dose of mRNA. Both choices are valid, and both will offer protection against COVID-19. The key is to sign up for both first and second doses, no matter which vaccine you take. This is the best way to protect yourself, your friends, your family, and the community around you. Thank you, and I'll now invite Dr. Yu to provide an update on the contact tracing system.
Great, thanks very much. Thank you, Premier. Thank you, Minister. Special thank you to Dr. Hinshaw, who has done incredible work throughout our pandemic response. This afternoon, I want to respond to suggestions that AHS failed to prioritize contact tracing as a key tool in our fight against COVID-19, and nothing could be further from the truth. From the very beginning of the pandemic, AHS identified contact tracing as a vital way to track community spread, to limit transmission of the virus, and to protect Albertans. Along with testing, the use of appropriate PPE, and now immunizations, contact tracing has been one of the cornerstones in our pandemic response. But it has always been one cornerstone. Contact tracing by itself does not bring down case numbers. It allows us to track the virus, to ensure people who may have been a contact are isolated, and limits community spread. We've seen that occur throughout the pandemic, most recently at the peak of the third wave. Contact tracing coupled with public health restrictions, masking, physical distancing, isolating when sick, and even simple hand washing are the most effective ways of protecting Albertans. Those tools have now been bolstered further with the vaccine. Innovations include text messaging, auto-dialing, and timely resources on our website so that Albertans could access information about contact tracing quickly and easily. Staffing our contact tracing teams has always been a high priority to ensure that we have the people in place to trace as many cases as possible. Our contact tracing system has never collapsed. Far from it. And such a suggestion does a disservice to our hardworking and dedicated teams who have done incredible work during all 3 waves. Since the beginning of the pandemic, AHS has aggressively recruited case investigators and contact tracers, as well as implementing innovative tools and solutions to increase our case investigation and contact tracing capacity. Our original team of 50 contact tracers in March of 2020 grew approximately to 300 in July, 700 in September, and 1,250 by the end of December 2020. From September the 25th to January the 25th, more than 1,250 formal offers to new contact tracers were accepted. About 1,000 new staff completed orientation in January of 2021. As an example of how we ramped up our contact tracing teams, at the peak of the first wave last spring, we had a high of 95 contact tracers working on any given day. At the peak of the second wave, we had 551. And at the peak of the third wave, we had 1,902. Our aggressive recruitment strategy also included agreements with Shoppers Drug Mart and the Ian Martin Group to provide regulated healthcare providers to support case investigation and contact tracing efforts, recruitment of Statistics Canada employees, international medical graduates, furloughed WestJet employees and AHS volunteers, work with professional colleges and associations across the province to share case investigation and contact tracing job opportunities with their membership, including retired and inactive members. It is true that we did experience some challenges last November and December when case numbers spiked. However, AHS continued to complete case investigation and contact tracing throughout the second wave. During November and December, our teams continued to call and complete case investigations on all high-priority cases. We communicated with all Albertans transparently at that time to let them know what was happening, and we built an automation for connecting with close contacts. As case numbers rose, we recruited and onboarded staff as quickly as possible. We were supported throughout this phase by Alberta Health. Coupled with stricter public health restrictions, which helped us reduce community spread, contact tracing was able to catch up with the number of daily cases, and we were again able to trace every case. During the Wave 3 peak, our tracers investigated more than 2,400 cases in one day, and on multiple days investigated more than 2,000 cases. And they were able to reach people who had tested positive within 2 to 5 hours, 80% of the time. This is an amazing achievement, and we should celebrate their work. Many jurisdictions have come to see what we're doing in Alberta and have learned from our innovations. Our teams continue to contact and investigate all COVID-19 cases within 24 hours of receiving confirmation of their positive test result. This has been happening since January the 9th. Now that case numbers are decreasing, we're again looking to adjust our contact tracing teams. We'll continue to monitor carefully the daily COVID-19 numbers in all areas of the province and adjust our contact tracing and investigation capacity accordingly. If numbers surge, we increase capacity. If numbers drop, we will shift staff to other areas that need more support. Be assured that we will maintain a robust team that will remain responsive to the evolving needs of the pandemic. We are well positioned to be able to meet the future demands for contact tracing in the province. Thank you.
Okay, we will now go to the phones for questions. Just a reminder for those on the line that we'll do 2 questions each, either 2 off the top or 1 question and 1 follow-up. Operator, can you please put through our first caller?
First is Julia Wong with Global News. Go ahead, Julia.
Hi, this first question is for Dr. Hinshaw and perhaps the Health Minister and Premier. So now that NACI says that mixing and matching is essentially okay, just want to get a few more details on how exactly this will be working in the province. Will the province give Albertans the option to mix and match, or is this only going to be based on whatever supply there's available at the time?
I'll maybe start with that. The option will be for Albertans to choose. I want to be clear, those who've received AstraZeneca as their first dose, they can choose either AstraZeneca for their second or an mRNA vaccine. And we have sufficient supply to offer Albertans that option. If we need additional AstraZeneca, we are able to obtain that from the federal government. But again, right now, we feel confident that we have sufficient supply to offer that choice. So it will be entirely up to Albertans to pick which of those options that they wish to receive. For those who started their series with an mRNA vaccine, we will, for the most part, be giving people the second dose with the same vaccine, and it's only in cases where there's a supply interruption where potentially we may need to complete an mRNA series with, again, either Pfizer or Moderna, depending on what's available in that situation, but that will be in a minority of cases. So the choice is really about those who started with AstraZeneca, who can choose either AstraZeneca or mRNA. And we do have information in more detail on our website to help people assess which option they feel is right for them, with links to some of the studies that help people know what evidence there is on both of those sides.
Thank you, Dr. Hinshaw. And exactly right. Exactly as I said earlier, and as Dr. Hinshaw said, the choice will be for those who had AstraZeneca as their first dose, and then the option will be available to them.
And Julia, do you have a follow-up?
Yes, thank you. This is for the Premier. You mentioned a few times that second doses are vital, that they're critical for this province's reopening, but they aren't a threshold in the reopening plan. Why not?
Well, could I get started? Okay. Well, yeah. Sorry. No, that's fine. No, I'll pass on to you.
Thank you. So actually what I said is that the second dose coverage is embedded within our plan for the safe reopening this summer. When we look at the total population protection, we're not just looking at first dose coverage, we're also looking at the 10% of second dose coverage and growing, as well as a factor which I don't think you've reported on in the past, which is, and other commentators seem to ignore, which is natural immunity occurring from prior infection. So we estimate that that's about 14% of the population currently, 10% fully vaccinated of the eligible population and growing, 64% of the eligible population with first dose coverage. So all of those numbers operate together as we move towards population protection. The bottom line is that the expert public health advice that we have received is that once we get to that key 70% number, represented in part by first dose coverage, backed up by growing second dose dosing and natural immunity, is that we will have reached a critical threshold in protection of the broader population, and that's where vaccines can safely replace public health restrictions.
Operator, can you please put through our next caller?
Next is Shannon Johnston with CTV Calgary. Go ahead, Shannon.
Thank you so much. This question is actually also for the Premier. Premier, I'm interested. What did you think of the Calgary Board of Education removing the name Langevin from one of its schools today? And should the same be done with Calgary's Sir John A. Macdonald and Bishop Grandin schools?
Well, I'm sorry, I'm not aware of the decisions they've made. Let me look into that. But with respect to our founding Prime Minister, I co-sponsored a bill in the House of Commons with a Liberal colleague to recognize Sir John A. Macdonald Day, to acknowledge our founding Prime Minister, without whom Canada would not exist. And as his authoritative contemporary biographer Richard Gwynne said, no Macdonald, no Canada. I think Canada is worth celebrating. I think Canada is a great historical achievement. It is a country that people all around the world seek to join as new Canadians. It is an imperfect country, but it is still a great country, just as John Macdonald was an imperfect man, but was still a great leader. If we want to get into cancelling every figure in our history who took positions on issues at the time that we now judge harshly and rightly, in historical retrospective. But if that's the new standard, then I think almost the entire founding leadership of our country gets cancelled. Tommy Douglas, who recommended the use of eugenics to sterilize the weak, as he said, if we talk about members of the famous five, heroes of Canadian feminism and the fight for equality for women, some of them were advocates of eugenics that we would now regard as deplorable. So if we go full force into cancel culture, then we're canceling most, if not all, of our history. Instead, I think we should learn from our history. We should learn from our achievements, but also our failures. Canada is doing that, just as as Prime Minister Harper made the official apology for the terrible injustice of the Indian residential school system, just as the Government of Canada provided over $3.5 billion in compensation to residential school survivors as a symbol of restitution. And just as Canada has addressed other historic injustices, which we seek to reflect in the draft K-6, social studies curriculum in far more profound ways than ever before. So I think it's much better that we learn from our history, including those periods of great injustice, without seeking to cancel our history. I think we need to know more about it.
Shannon, do you have a follow-up question?
Yeah, it's just a little bit on that then. So would you still like to see a statue of John A. Macdonald at the legislature?
Well, there are statues of John Macdonald all across Canada, which is only natural given that he is our founding Prime Minister, without whom the country would not exist. And so if you want to apply, I must ask why this question is only ever asked about John Macdonald and not Sir Wilfrid Laurier, who, for example, increased the Chinese head tax by tenfold, effectively to bar immigrants from East Asia. Wilfrid Laurier, who brought in the continuous journey policy, which led to the tragedy of the Komagato Maru, and which was a racist policy designed to prevent people of South Asian origin from immigrating. Sir Wilfrid Laurier, who signed an order in council barring black people from entering the country, and who maintained the same residential school policy that began under the Macdonald administration, in fact, expanded it to its peak in, I believe, the 1920s. And so this is the problem with your line of questioning. If we want, if the new standard is to cancel any figure in our history associated with what we now rightly regard as historical injustices, then essentially that is the vast majority of our history. Instead, I think we need to learn from it, to learn from both the greatness, the audacity of vision, and the generosity of spirit of former leaders. It was John Macdonald who proposed extending the franchise, including to First Nations people, long before that was popular, and to women. Those ideas weren't accepted at the time. But that's an example of the complexity of those historical figures who operated in a radically different time. So I really think it's inappropriate to focus on one or two figures. If we want to get into a debate about cancelling Canadian history, we need to understand that it means all of our history. And I think that's that kind of destructive spirit is not really the spirit of reconciliation. The spirit of reconciliation is to learn from the wrongs of the past, to seek to remedy them while knowing our history and moving forward together.
Operator, can you please put through our next caller?
Next is Janet French with CBC. Go ahead, Janet.
Hi there. Thanks for taking my question. I've got one for the Premier. Yesterday you spoke in the House about the importance of fulfilling the Truth and Reconciliation calls to action regarding missing children in burial sites. However, another call to action says that children should be learning about residential schools and treaties in every grade from kindergarten to grade 12. Your draft curriculum introduced residential schools in grade 5. In light of what we've seen in recent days, do you still believe that children should learn about residential schools, should not learn about residential schools until grade 5? And if so, why is that?
Well, as you may know, under the current Alberta curriculum, the subject of Indian residential schools is not raised until grade 10 in the social studies curriculum. And then I believe there's only one reference. The draft K-6 social studies curriculum introduces 10 separate references, including a proposed exercise for students to read aloud from the Truth and Reconciliation Commission, to listen to audio and video testimony of residential school survivors, to be educated about the separation of children from their families, about the denial of their language and culture, about all of those terrible aspects of the injustice of residential schools. So what we are proposing is a huge increase in content over the current curriculum with respect to Indian residential schools. And if there are suggestions for more age-appropriate content, this is a draft curriculum. We're open to additional suggestions. I actually just wanted to come back to the latter point I was making about the kind of selective application of cancel culture to our history. Just to carry on the same line of thought, the longest-serving Canadian Prime Minister, William Lyon Mackenzie King, adopted the none is too many policy that made it effectively impossible for Jews fleeing the Holocaust to seek refuge in Canada. It was known as the none is too many policy. It's been historically documented, a gross historical injustice. The late Prime Minister Pierre Trudeau brought in martial law and led to the arbitrary arrest of thousands of people with absolutely nothing to do with the FLQ crisis. Previous prime ministers associated with the internment of Italian Canadians that were just apologized for, of Japanese Canadians during the last war. There is no shortage of sadness, tragedy, and injustice in our past. The greatness of Canada is that we have overcome those things. Yes, we have had imperfect leaders, and yes, we have had imperfect institutions, and yet we have still built through that a country that is the envy of the world. We learn from those shortcomings, whether learning from the eugenics proposed by Tommy Douglas or the history of eugenics here in Alberta. When I was the Federal Minister of Citizenship and Immigration, I spent a great deal of time in developing a new study guide and test for aspiring Canadian citizens. The new study guide, Discover Canada, for the first time mentioned these injustices, the Indian residential schools, racist immigration policies, and other black marks in Canadian history. I think that's the solution, which is to present young people with, to present all Canadians, including new Canadians, with a balanced depiction of our history, including the terrible, gross injustice and tragedy of the Indian residential schools.
Janet, do you have a follow-up question?
I do, also curriculum related. So today we heard from Julianne Sever, who's the granddaughter of Agnes Lupler Perry Cheney. She was asking your government to stop using her grandmother's name and story as part of the draft curriculum. She said her inclusion is unnecessary and tokenistic. Your education minister says that her story is part of the public domain, but why does a curriculum need to name specific people at all? Can't you let teachers choose which stories of Black history are the most illustrative of Black history in Alberta?
Well, we've made a very particular effort to have a more inclusive curriculum that reflects the diversity of our history, with a massive increase in the number of references to Black people in the founding of the Northwest, in the history of Alberta, and we're proud to have done so. And I must confess I don't understand the question. The curriculum is about the core content that will be presented to young people, in this case in social studies. And so the curriculum has to include content. When you're talking about history, you're talking about real facts, real events, and real people. It can't be a curriculum completely denuded of any reference to particular events and people. It ceases to be history if it is that. I don't look. I'd be happy to ensure that the minister takes on board any constructive input from folks, including those who are descendants of historical figures in the province. But history is history, and we should seize every opportunity to teach young Albertans about the remarkable history of overcoming adversity of the Black community in Alberta. It was historically a very small community that had to overcome very often prejudice to triumph over adversity. I think that's a noble and inspiring story.
Okay, and it looks like we have one more question left in the queue, so operator, can you please put through our last caller?
Final question is Adrian Williams with CBC. Go ahead, Andrew.
Hi, my first question is for Premier Kenny in French and maybe in English, since no one has asked this question before. So my question in English is, how are you going to work with Ottawa regarding, or what are you recommend to Ottawa regarding the reopening of the U.S.-Canadian border? And the mandatory quarantine at the hotel?
Sure. So English and then French. We discussed this last week with the Prime Minister and all premiers, and I called for first of all, I applauded the federal government's travel bans for direct travel from variant hotspots like currently Brazil and India, because we do need to take great caution with those variants. But I did strongly encourage the Prime Minister to develop and then implement a plan to begin normalizing travel, obviously maintaining certain safe protocols. I suggested there are a lot of good precedents around the world about how to do this. One would be to facilitate travel for people who have been vaccinated. Another would be to maintain testing requirements for those who maybe only one dose or have not yet been vaccinated. Another approach that some European countries have adopted would be a travel light system for countries of concern with high viral spread and particularly variant spread versus, for example, countries with very low levels of transmission and high levels of vaccination. My point was that there are a number of different policy models to look at, and I did offer the successful experience of the Alberta travel pilot as a great precedent. In fact, we call upon the federal government to work with us to reinstate the Alberta travel pilot. Our Alberta health folks continue to actually work at Calgary Airport, helping to administer the federal testing requirements. So we've got the infrastructure, we've got the testing capacity, we've got the best variant screening system in the country. And we have the experience of having administered that program successfully for several months. So we would be happy to bring that program back online and for it to be applied for testing on arrival to individuals who don't have proof of a negative test or, for example, having been vaccinated. So there's a lot of different ways that we can construct a smart, light touch program that protects public health here while allowing us to get our lives back to normal in terms of exercising our mobility rights and reigniting the hard-hit travel and tourism industries. So, yes, to targeted restrictions from places with widespread variants, but at the same time, let's move forward. Certainly, we hope by July, as the country gets to something like 70% protection with thoughtfully relaxing some of the travel restrictions. So I'll try to summarize that in French more briefly. To say that la semaine dernière, j'ai parlé au Premier ministre à cet égard pour l'encourager à réinstaller le programme pilote de voyage qui a été mis en place pour l'Alberta l'année dernière. C'était très effectif et on a toujours l'infrastructure présente à l'aéroport de Calgary pour qu'on puisse identifier les cas problématiques avec les tests à l'arrivée. Et il y a toutes sortes de politiques possibles et nous voyons les systèmes différents, mais le truc est il faut mettre l'accent sur les populations avec un niveau élevé de virus, particulièrement les variants, mais par contre de faciliter le voyage normal, particulièrement par exemple avec les États-Unis et les autres pays avec un taux de vaccination très élevé.
Do you have a follow-up, Andréane?
Yes, I have another question again for Premier Kenny in both French and English. So how are you, or how certain are you that there won't be delays in receiving more vaccines, because there have been delays in the past? So how certain are you that this won't happen and that we will be able to vaccinate everyone by the end of June? Did you talk to the federal government about that, or even the companies that produce the vaccines?
Well, we have had some of our own discussions with the vaccine producers, but we are dependent on the procurement of the federal government because they signed those contracts first. So we can't jump the queue. We are dependent on their sourcing. And they do provide us with a schedule of anticipated arrival of doses. It usually runs, they give us quarterly targets, but we have found in the past few weeks that the weekly targets are being met, particularly with respect to Pfizer, which has become the mainstay of our program. We continue periodically to experience sourcing delays from Moderna. We are expecting a big national shipment of, I think, 1.5 million in the next week for Moderna. But generally, we have been reliably receiving 250,000 Pfizer doses every week on time, on schedule, and that's been the mainstay of our program. So we've administered 2.8 million doses as of now. We're expecting a little over 1 million new doses over the next month. So we know then we have a reliable supply to continue prioritizing first dose demand while covering off the second dose requirements. So I'll just say that, long story short, we know we've got the Pfizer at the very least, reliable supply of about 250,000 a week, and that's what our plan is really based on. En français, pour dire que c'est vrai qu'on a eu des problèmes des vaccins plus tôt avec l'annulation, l'incertitude et tout ça. Mais dans les dernières semaines, nous avons vu un sourcement des vaccins beaucoup plus stable, particulièrement avec le Pfizer. Nous recevons environ 250,000 doses de Pfizer chaque semaine. Ça veut dire, dans le mois prochain, nous attendons plus d'1 million de doses de Pfizer et peut-être davantage de Moderna. Et avec tout ça, nous pouvons faire continuons avec la demande pour les premières doses et administrer les deuxièmes doses avec confiance. Did you want to add to that? Well, the Minister Shander would like to add to that one moment.
Well, just also to say that one of the reasons why we are confident is because we have been provided by the federal government with the allotment table up until the end of July. So we know for the Pfizer vaccine, our allotments until the end of July. Of course, Moderna, as Premier pointed out, it does not have the same certainty and predictability in its delivery. But for the Pfizer vaccines, that has allowed us to be able to make the plans for the first doses and to estimate the amount of uptake that we will have for us to be able to reach the targets by the end of the month for the Open for Summer plan, as well as us being able to make the decisions that we announced today for our second doses and be able to plan for second doses announcements for those who received their vaccines in April and May. We knew we could do that planning because of the allotment tables we received from the federal government. Thank you.
And that concludes our time today. Thanks for joining us and have a good evening.